know what I am?
Good evening, everyone. So we'll be starting with our presentation pretty soon. There's still few minutes left. So we'll be starting with our presentation in a couple of minutes. Thank you. Still waiting for the participant to come in. Okay, so good evening, everyone. This is my third presentation actually today, and I hope all of you have attended my previous two presentations, and I hope those presentations were helpful for you, and that's the reason why you are here, right? Okay, so we'll be starting with our presentation pretty soon. For a smooth transition without interruption of the presentation, I'll be switching off my video, so there won't be much distraction. And also, if you feel like there is some technical problem or something, you can just put it in the chat box. All right, I hope everyone can see my presentation, my screen, and hopefully everyone can hear me properly, right? Just a thumbs up will do. Okay. Yeah, got it. Okay, so here we go. Good evening. As you know, myself, Dr. Abhijit Patel. I'm a prosthodontist and I'm a Canadian PR, and I've started this Canadian PR and dentistry series a few months back in order to educate the dentists who are hoping or who want to move to or migrate to Canada for better perspective and better future and better career. So this is my third presentation in my Canadian PR and dentistry series. And I hope you have attended my previous lectures, my previous presentations, and those were helpful for you. Okay, so now this particular program, it came into my mind because of the reason that the situation that I have seen, and whatever the situation, actual situation, ground level situation in Canada. So that's why I thought it is better to give you the idea about it, because if you are going to a new country, it is always beneficial to have their credential, their education. So it is pretty much easy for you to get integrated into their system properly. Okay, so this is mainly a second, I would say a second route. If you people cannot find your way into the Canada with the help of express entry profile, maybe the reason that you don't have sufficient degree or work experience after completion of your MDS or BDS, or you might have a little bit age related factor. So that these are mainly two reasons. Because of that, your CRS score is lacking and you couldn't go up to that level. So what education programs will give you is, first of all, it will give you with the Canadian degree, and with the Canadian degree, you can definitely get a Canadian job. Okay, so if you enter in these two things, what you will have, you will be entering into the Canadian experience class in express entry program, which is completely different from a regular express entry program. Okay, so Canadian experience class, there are sure chances, 100% chances for you to get a permanent residency of Canada. So that is the main reason behind for me to conducting this presentation. Okay, so to give you a brief idea about how education system works in Canada. Now, it is not much different than what we have here in India. The education is divided into three parts: the primary education, the secondary education, and the tertiary education. The tertiary education could be a college education, college level education, or university level education. Okay, primary education is must, it is compulsory for all Canadians, and secondary education is, it is depend upon, it is very subjective decision. Again, all the education, if you are a permanent resident and if you are a citizen, the primary education is completely free of cost. Okay, now the education system is completely governed by provinces. Provinces are the states in Canada. So the curriculum in one state could be a little bit different than curriculum and rules from the other state. Okay, so the college level programs are basically you have your bachelor's degree, they'll give you bachelor's degree, they'll give you graduate certificate, or they'll give you advanced diplomas. Okay, now advanced diplomas, graduate certificate, bachelor's degree, these are provided into mainly vocational education. Okay, they are field related specific educations. So these are the college programs, and mostly the colleges in Canada, they are either publicly funded or they are private colleges. Okay, like we have in India, we have other, we don't have that much of public education, emphasis on public education, but mostly the colleges in Canada, there you'll find many college which are publicly funded, which are regulated by provinces or local governments. Then comes the university programs. University programs are basically your, again, bachelor's degree, master's degree, or PhD degree. Now, master's degree and PhD degree, they are only provided by universities. They are not provided by colleges, either public colleges or private colleges. Now, bachelor's degree is typically 4 years. The duration for the bachelor's degree is typically 4 years. For master's degree, depending upon the program, it could be 1 year to 3 years. Okay, and for PhD degree, again, is, you know, it is a research based degree, so duration can last from 3 years to 6 years. Okay, so this is how the education system is basically is in Canada, all of the same in all the provinces and territories. Now, I have divided programs into certain categories. The first category is programs directly related to dentistry. Okay, the programs which are directly related to dentistry, they are divided into degree completion program, master's program, research program, and joint programs. Okay, so we'll be seeing all these programs one by one with the university wise. Then the second category is you have your dental auxiliary programs. Okay, these programs are denturist, dental hygienist, dental assisting, dental office administration, and dental technology. These are the programs which are included into dental auxiliary profession. You have to note that, again, these professions, dental auxiliary profession, again, regulated, highly regulated in Canada. Not dental office administration as such, but all others, denturist, dental hygienist, dental assisting, and dental technology, these programs are regulated. That means you need to have license to practice in these professions. Now, the third category is applied health sciences. Now, if you don't want to go ahead with your dentistry career, you have some other career which you can build upon your existing dental degree. Okay, so these programs are either diploma or masters in health administration, diploma, masters in health management. They are pretty much the same with minor differences. Then master in science in management and healthcare informatics. These programs are basically conducted, they are organized by applied health science department and the management or business department of particular school or the universities. All right, so now we'll be seeing all these programs one by one. The first one is degree completion program. This is the one I have talked about before in my previous presentations, in my previous webinars. So degree completion program is basically, this program is for dentists with international degree whose degree is not accredited by CDAC, Commission on Dental Administration. Okay, CDAC is the commission which regulates the dental profession in Canada. So if your degree is not recognized, not accredited in Canada, then you have to go for degree completion program. But the biggest problem with this is you need to have a Canadian citizenship or PR for this program. Okay, that's the main thing. If you don't have Canadian citizenship or PR, you cannot apply for degree completion program. But there is hope. The University of Manitoba is the only university which offers this program to international applicants. Yes, so you have Rady Faculty of Health Sciences, in which you have Gerald Niznik Faculty of Dentistry, which provide this program for international dentists. So you don't need to be a Canadian citizen or permanent resident in order to apply for this degree completion program in University of Manitoba. That's great news, right? So in brief, I'll explain you, I have explained this before also, how degree completion program works. Basically, you have to put your application and you have to get your BDS degree evaluated from NDEP, National Dental Examining Body, right? So once you do that, if your application, when your application is approved, you can sit for your assessment of fundamental knowledge exam. So once you give your assessment of fundamental knowledge exam, you can apply for various degree completion program. Now, here we are going to talk about degree completion program specific in University of Manitoba, because in all other universities, the degree completion program is only for Canadian residents, permanent residents, and citizens. Okay. So once you enter in that program, either second year or third year, you complete that program along with other DDS or DMT students. Then you give your NDEP certification process, in which you have NDEP written exam and OSCE. And once you pass that, you'll get an NDEP certification to practice dentistry anywhere in Canada. So now, University of Manitoba, the degree completion program, it is called as International Dentist Degree Program, IDDP. All right. So this program, as I told you, it is open for international applicants as well. So when you enter as an international applicants, you are treated equally, okay, as domestic applicants and international applicants. They don't see much of a difference. They don't differentiate between them. Now, there are two types, track A candidates and track B candidates. Okay. Now, what is a track A candidate? Track A candidates are those candidates who have applied, who have done their NDEP registration and who has given their assessment of fundamental knowledge exam, and they have minimum of 55 percentile in their AFK examination. Okay, minimum 55 percentile. Now note here, the minimum passing criteria for assessment of fundamental knowledge exam is 75 percentile. But in order to apply in University of Manitoba, you should have 55 percentile. Pretty generous, right? So then you have track B candidates. In track A, the AFK examination should have given 2 years prior to your application. So if you are applying in year 2020, you shouldn't have given it after February of this year, because assessment of fundamental knowledge exam happens twice here, in Feb and in August. So you should have finished your assessment of fundamental knowledge exam on the same year in February, not in August, or 2 years prior to your application. Okay, that is track A candidate, and you should not appear for assessment of clinical judgment and assessment of clinical skills. So you should have only appeared for assessment of fundamental knowledge. That is track A. Track B students are those students who have passed their assessment of fundamental knowledge, who may have appeared for assessment of clinical judgment, but they have appeared for assessment of clinical skills in the same year of application for this program. Okay, I'll understand you the difference. Why is there so much of difference? So after passing your assessment of fundamental knowledge, it is not compulsory. You can appear for assessment of clinical judgment and assessment of clinical skills together. Okay, it is not like you have to pass the assessment of clinical judgment first, then you can appear for assessment of clinical skills. No, you can give those exams consequently. All right. So the main thing they want here for track B students is they have given assessment of clinical skills examination. Okay. And not more than in the same year of application. So that is track B students. Now, what is the advantage of that? I'll tell you in some time. Now, what are the requirements for this application, for your application? Now, for all the application, all the programs, you should have to have your transcripts and internship completion. Transcripts are directly sent from the university. You cannot send the transcript, they won't accept it. End-up examination result in case of track A student, only AFK result. In case of track B students, AFK result, as well as your ACS report, assessment of clinical skills. IELTS academics, not general. IELTS academics you have to give with band 7. Good standing certificate. Good standing certificate is from current organization where you are registered. Like in case of India, you should have good standing certificate from Dental Council of India. You have to submit it. Then autobiographical sketch. Autobiographical sketch is a letter of intent in which you have to write that why you are interested in this particular program and what you can offer from your side to the university, to the department, and to this program. Okay, so it should be good, pretty convincing. Then you should have your resume and 3 references. They take references pretty seriously. So if you have some good references on your list, on your application, there are better chances for you to get accepted. Okay. Admission happens in this. I told you track A and track B. Now track A, if your application get accepted, track A students are asked to come to the faculty, to the university. Personal interview happens. After personal interview, you have to do psychomotor skill exam. You have to give psychomotor skill exam in which you have to do crown preparations and cavity preparation on typhodont. This is only for track A candidates because they have given only assessment of fundamental knowledge. Okay, if you are a track B candidates, you don't have to give psychomotor exam at the university. You just have to appear for personal interview because you have already given assessment of clinical skills examination from NDEP. So that's the difference, okay, between track A and track B. After acceptance of your application, track A student, they have to give psychomotor skill examination in the university. Track B student, they don't have to appear for that examination. All right. So this is the International Dentist Degree Program in University of Manitoba. Then the second part I'm coming to is the master's or graduate programs. Now, master's and graduate programs, as I told you, they are only offered by universities. They are not offered by any private or public colleges. Now, if you have the master program is directly related to dentistry, it is offered by universities with faculty of dentistry. Then you have clinical programs, research-based programs, and non-clinical programs. And you also have combined programs. Now, combined programs, they have a component of clinical program and research-based program, or non-clinical program and research-based program. So 2 programs are combined in combined programs. We'll see about these programs one by one. Now, coming to the University of Manitoba, I find this university very generous as compared to Canada. They have policies like American universities. So they don't have much stringent rules. So that's why I have included this university first in my list. Now, university, as I told you, University of Manitoba is in Winnipeg. Winnipeg is the capital of Manitoba province. In India, we call states. In Canada, they called it provinces. Okay. So in Manitoba province, the capital of that province is Winnipeg, and in the background you can see the beautiful campus of University of Manitoba. So they offer these following programs: Master of Science in Oral Biology, Master of Science in Orthodontics, Master of Science in Pediatric Dentistry, Periodontology, and Prosthodontics. Okay, so you should not think that this is Master of Science like what we have in India, right? No, the master's degree in Canada, they called as MS, okay, Master of Science. So the first degree, Master of Science in Oral Biology, it is particularly a research-based program. It is not a clinical program, it is a research-based program. So it is 3 years in duration with non-clinical program with thesis preparation. So you are full-fledgedly involved in a research in their faculty, along with the different research clusters they have in their universities, in their departments. The program is designed for students who wish to pursue a research-intensive program of graduate training in oral biology. Okay, so it is pretty much similar to the oral medicine what we have in India, but it is completely research based. Okay, so if you are interested in going for a research, if you want your career in research activities in big companies or in faculty of universities and different dentistry department, then this is the program for you. Okay, and after completion of this program, you won't get any licensure to practice dentistry in Canada. So that is the most important point you have to consider. You have to keep it in your mind, right? So it is required that applicants identify an advisor who has agreed to supervise the applicant's research program. So the research program should be in your mind before only. Okay, with your research program, you have to contact the supervisor. There are different supervisors in different research programs in Faculty of Dentistry. So you have to contact them directly if they are pretty much convinced with your topic or if your research thing, then they'll accept you in the program and then you can go ahead with your application. Okay, so these universities, they very much believe in one-to-one contact, interacting with applicant, giving very personalized touch to it. Okay, so you shouldn't find it difficult because it is way better to get involved in any program, right? Now the second programs now all these programs are clinical programs, right? There is MS in Orthodontics, Master of Science. Again, it is 3 years clinical program with thesis preparation, the same thing that we have here in India, the MDS program, where we have to do our thesis, we have to do our research, and we have to submit a printed copy of that, and we have to publish the same research in national or international journals. Okay, now in this program, they accept only 3 students each year. Preparation for master thesis is the requirement. Then you have oral defense of their research project. Like we don't have this thing in India for MDS, but oral defense is for PhD program in India, but they have that for MS programs in Canada. Then you have to do a presentation of their research at an international forum. They will give you the platform to do all the presentations. All right. So the submission of an article for publication based on their research, different publications you can do on your research, limited teaching in the undergraduate orthodontic clinic. So you are involved in the teaching part also. Then participation in outreach to underserved communities. Now you will find these kind of things mentioned in all the programs of University of Manitoba. The reason being the Manitoba region, the Manitoba province is not that much developed compared to Ontario, British Columbia, Alberta. Okay, it is still underdeveloped. I won't say it is poorly developed, it is underdeveloped. So that's why there are many communities which are scattered in Manitoba. So you have to serve in particular location, okay, to treat their problems in those communities. Now the second program is MS in Pediatric Dentistry. Again, this is the only program in University of Manitoba where you are paid stipend of $60,000 per year. Okay. Now, the stipend is, if you are eligible for it, yes, there are some procedures for that. So if you are eligible, you are paid a stipend of $60,000 per year. Now that is paid because I'll tell you the reason for that. Again, this is a 3-year clinical program with thesis preparation. This program admits only 2 students each year. The program involves university coursework in Aboriginal and rural cultures, and communities, as well as intensive research program in prevention and community dentistry. Now, the third year of this program, it involves placement and research in rural and remote areas. Okay, so you'll be working on behalf of universities in those areas. So that's why the stipends are paid. Now, I would like to mention one thing here. I'm not including the tuition fees and other details. I'll be giving you, all of you, a separate PDF after this presentation. I'll mail it to you with each particular program, their duration and the tuition fee for this particular program. Because if I try to tell you tuition fee and everything in this presentation, it will be a little bit too much for you to comprehend. Okay, so I'll provide it to you separately, so you'll be able to see the difference between the tuition fee, which is feasible for you. Okay, so now this is what MS in pediatric dentistry. Now the next program is MS in periodontics. Now this program is again 3 years, thesis based. This program admits 5 students every year. Now this program, now they have a very much interdisciplinary management, interdisciplinary action going on in their universities, and it is said and it is followed. Okay, so you'll be involved in this case with other departments like perio people. They are involved in oral pathology people, as well as prosto people, to treat the different patients. Prosto and ortho, it is prosto and perio is for treating complex implant patients or implant failures. Periodontics and oral pathology for periodontitis or other advanced periodontal diseases. So this program happens in collaboration with different departments. All right. Now the last one is your MS in prosthodontics. Again, this is a 3 years clinical program with thesis preparation. This program admits 6 students each year. Out of that, 2 students they admit as a dentist, fully practicing dentists. Okay. Then the program is further enhanced by close collaboration with graduate program in oral surgery, periodontics and orthodontics. So all these be working as a cluster together to help improve the outcome of the program. Okay, so they are involved in joint seminars and case presentations and etc. And the research which is involved in this particular program, they emphasize mainly on the clinical or the material research. Okay, the material which are involved in prosthodontic treatments or clinical research related to implant dentistry. Now, the second university I'm talking about is McGill University. McGill University is in province of Quebec, okay, and it is in city of Montreal. Okay, so Quebec is, as you know, it's French dominating area. Everything is in French, but this is the university, it is English university, so they provide their programs in English language. Okay, otherwise there are 2 other dental colleges in state of Quebec, but they offer their programs only in French language. All right. So now McGill University, you can see the beautiful campus in the background of McGill University. So they provide 2 programs, Master of Science Dental Science thesis track and Master of Dental Science non-thesis tracks. Okay, these are the only 2 programs they offer for international dentists. Okay, so Master of Science in Dental Science thesis track. What is the objective? The objectives of the program is to perform a literature review. Again, these 2 programs are again research based. They are not clinical based, and they won't give you any licensure. Okay, as I've explained the programs in Manitoba University, after completion of those programs, you are eligible for licensure. Okay. But after this MS in Dental Science thesis track, it will just research based. So the objectives are perform a literature review, identify important issue in a specific field and understand the scientific approach to research questions, carry out a scientific study and appropriately manage its data, appreciate the ethics involved in animal and or human research, and express oneself clearly in science when speaking and writing about your research or other researches. Now, MS requirements for this program is applicants must have successfully completed DMD, DDS or equivalent program like BDS or BSc degree also in science with CGPA grade point average of 3.0 in any of the disciplines in the health sciences. Now, this CGPA, you can get it from the evaluating agencies for your BDS and MDS program, or you can submit, you can ask these university, these faculties to get it checked for you before application, if to see if you are eligible for this program or not. So you can contact them separately. So in your application, what you have to do is you have to mention which researcher or research area you are interested from 4 research clusters. So McGill University, they have 4 research clusters. They are pain and neuroscience, mineralized tissue and extracellular matrix biology, biomaterials, nanobiotechnology and tissue engineering, and population oral health. So now these clusters, they have different faculty members in each of these clusters from different departments. Okay, engineering departments, biomaterial departments, then management departments. From all the departments, they'll be having different faculty members. So from these 4 clusters, you have to select which area you are interested in. You have to go into that particular program, see who is the director of this program, contact them directly, and you have to convince them that you are interested in doing research in their cluster, and you have to apply, you have to put it in the application. So now what happens is, for each student, if you get accepted into the program, you have to present your proposal of your research proposal in the second term of the program. Okay, so if it is accepted, you can continue with your program, you can continue with your research. If it is not accepted, then they'll give you 3 months more to complete your application, to refurbish your application and present it again. Then it is accepted, then you can continue with your program and with your research. So this program, it has a research advisory committee, consists of research supervisors. So you should have to have a supervisor for this program who will be like a guide, okay, who will be monitoring all your progress in your research under his guidance. And along with that, you might have 2 or 3 other staff members which are the part of this committee. So they'll see how the progress of your research is going on. Now the second is MSc in Dental Science. Again, this program, the thesis track is 2 years program. This Master of Science Dental Science non-thesis track is again 2 years program. The basic difference between non-thesis and thesis: for non-thesis, you don't need to have supervisor. It is not research based. You don't have to do your original research. You are involved in the research which are already going on into the faculty, right? So this program provides students a great opportunity to clarify their interest. So your interest, if you're confused that you don't know where exactly you want to do your research in, okay, so you can enroll in this program. You can make up your mind what exactly you're looking for and what other programs, what are different clusters have to offer to you, and you can decide and enter into those particular clusters. Now again, application requirements are the same: CGPA, grade point average of 3 in any disciples in your BDS or your MDS. Then the applicants must be accepted by Office of Graduate and Postdoctoral Studies. And this program only has one start date, which starts in fall term, which is in March. Now, this third university is University of Alberta. Now, University of Alberta is in Edmonton, which is capital of Alberta province. Okay, it is more towards the west coast, next to British Columbia, your province of British Columbia, and it is again very beautiful province, much developed than your Alberta and your Manitoba and Saskatchewan. So this particular university has more courses to offer for international dentists. First, I'll explain to you about these 2 programs, which are MS in Dentistry and MS in Oral Biology. Now, MS in Oral Biology is pretty much the same as I told you about University of Manitoba. Again, MSc in Dentistry and MSc in Oral Biology, they are research-based program, and this completion of this degree won't give you any clinical specialization, and it is unrelated to licensure. Okay, the admission requirements are again GPA of at least 3 or more. The program is again research-based, with consist of didactic course, original research carried out under supervision, and preparation and completion of the thesis. So once you are admitted into the program, you'll be getting your supervisors and other things, and you can continue with your research. Now, the other programs, which are these 3 programs, they are clinical dentistry program. Okay, they are clinical based program, unlike previous 2 programs, but there is a catch in this. If you don't have a license to practice dentistry in Canada, then you will be placed, if you get accepted into these programs like MS in oral medicine, MS in periodontics, or MS in orthodontics, you will be placed in teaching and research registry of Alberta Dental Association and College. Alberta Dental Association and College is the dental regulatory authority of state of Alberta. Okay, it regulates dentistry in state of Alberta. So you won't be having license to practice dentistry in Alberta, but yes, you can have a teaching or an academic job or a research job in anywhere in Canada. Okay, so in order to get the licensure, you have to pass the licensure examination. This is only because the bachelor's degree that you have is from non-accredited program, non-accredited universities. That's the reason. But the graduates of this program are prepared to challenge the Royal College of Dentists of Canada Fellowship National Specialty Examination and American Board of Periodontics or American Board of Orthodontics program. Okay, so that is a big, huge plus point for these programs. Now, again, requirement for this program is completion of university degrees required, like only BDS or MDS also, and at least GPA of 3 for oral medicine and periodontics, and for orthodontics you should have GPA of 3.4. Now again, the documents which are required are your official transcripts from university, then your TOEFL or IELTS exam, again academics, and letter of reference completed from 3 different referees, and your curriculum vitae, which should include all your education, qualification, publications, previous professional experience in India or anywhere else. If you have any research experience, so you should try to include maximum in your application so that there are better chances for you to get accepted into the university program. Okay. Now the next one is University of Western Ontario. This university is in London, city of London in Ontario state. Okay, it is not London from UK, right? This is London in Ontario state. I have included particularly this university. This university doesn't offer any programs to international dentists, but still I have included 2 of their programs, which are Dental Clinician Scientist program and Schoolage Dentistry Research Opportunity program, just to make you aware of, because these programs I found they're good. Okay, they're actually good programs. So any one of you, if you get a PR or if you get admitted into the degree completion program in University of Western, you should definitely try for these 2 programs, which are Dental Clinician Scientist and Schoolage Dentistry Research Opportunity program. So now Dental Clinician Scientist program is again a combined program. I've told you there are combined program. Combined program is this degree, this program will give you a PhD degree as well as the DDS degree. Okay, so you can see what is the benefit of this program, right? So you have, at the end of your program, you'll have your PhD degree, which is completely a research-based degree, and a DDS degree, which is a practice-based, clinical-based degree. So what is the objective of this program? It is for highly motivated individual students whose objective is to become a productive clinician scientist. Okay, so in order you can do a clinical research. Okay, that has huge advantage. Okay, huge demand. So this, again, as I told you, this program is only for Canadian citizens and students with Canadian permanent residency. So but this program is good, that's why I've included into my presentation. Then the second one is your Schoolage Dentistry Research Opportunity program. So now if you get, after PR, if you get admission into the international dentistry program in University of Western, then in any year, 1 to 3 years, you have eligibility to get enrolled into this particular program where they encourage students to do a research. Okay, so if you are interested in clinical degree as well as a research-based degree, then these 2 programs I found that these are good programs. That's why I've included in my presentation. Now, the next one is your Dalhousie University. Now, Dalhousie University is in Halifax. Halifax is capital of province called Nova Scotia. Okay, it is on the Atlantic side, onto the east side of Canada. And this is again really beautiful university. You can see the Faculty of Dentistry building in the background. Again, little bit cold, right? Compared to other provinces of Canada. So you have to be very much prepared for it. Now, this university offers only one program for international dentists, which is of Master of Periodontics. This is again 3 years Master of Periodontics program, which is designed to train competent periodontists to practice full scope of periodontics, surgical implant dentistry, temporomandibular joint disorders, conscious sedation, and participation in research. Okay, so all these components are covered in your Master of Periodontics degree. Again, it is clinical based degree giving you the specialty licensure to practice in Canada. Okay. Now, after completion of DDS, the requirement for this, you should have 85% of average. Now, this is one thing which I find very questionable to get 85%. I don't think so it is possible to get 85%, or if you have, then it is more than, it is totally amazing that you have 85-degree percentage either in your BDS or in your MDS degree program. Then you need a certified copy of your degree and original letter from Dean certifying graduation and date of graduation, transcripts, 2 references, letter of intent, English proficiency, IELTS 7.5 band in academics, and application deadline for this program is June 1. Okay. Now coming into the next is a beautiful University of British Columbia, which is in Vancouver. All right. So again, very, very, very beautiful province of Canada, very much developed and completely English speaking. So this university, again, like University of Manitoba, has many programs for you for international dentists. I've divided into research programs and clinical programs. Now, research programs, they are MS in Craniofacial Science and Master in Public Health with Diploma in Dental Public Health. So MS in Craniofacial Science, it is advanced study leading to MS in Craniofacial Science through the research in publication, research in population and oral health. Oral health related clinical research includes both interventional and observational studies, basic cell science research like cell biology, development biology, and biomaterials, different biomaterials which are used in dentistry. Now, requirement for international applicants are minimum overall average equivalent to University of British Columbia B+ or 76%. So now this university to university, these things changes. So in order to get eligibility for particular that province, you should talk to that university, that particular faculty, and you should send your transcripts, just the scan copy. So they'll able to tell you if you are eligible for this program or not. Okay. Again, IELTS academics requirement with band score of 7 and not less of 6.5 in any component. The components are listening, reading, writing, and speaking. So you should not have less than 6.5 in any individual components. Now, very interesting part about this MS in Craniofacial Science is the faculty provides you with the opportunity to qualify for qualified students to enter into a combined program. What is this combined program? I'll tell you in subsequent your slides what are these combining programs are. Then the second program is Masters in Public Health with Diploma in Dental Public Health. I don't think so much of students they're interested in this kind of program, but still I have included it. Again, research-based, public research-based program. Again, non-clinical program, non-thesis program allows students to advance their knowledge in dental public health. Requirements are the same for the MS in Craniofacial Science, 76 percentile, IELTS academics with 7 band, and applicants, the only difference is applicants are required to have passed GRE or GMAT, graduate record exam, with score of 550. Okay, because it is a research statistical based program, so you should have this, you should have proficiency in quantitative skills. So that is, they judge with your GRE or GMAT exam. Now, what I was talking about, I've talked about MS in Craniofacial Science, the combined program. This is what combined programs look like. It is, if you are admitted into Craniofacial Science MS program, then they'll offer you to get enrolled into diploma programs of either diploma in endodontics, orthodontics, pediatric dentistry, periodontics, and prosthodontics. Okay, so that is a huge bonus because this will give you a licensure to practice specialty in Canada. That is a huge thing. Okay, so this combined program is a clinical specialty program that allows students to complete MS in craniofacial science along with clinical specialty preparation through the diploma. Okay, so the diploma component is your endodontics, orthodontics, periodontics or prosthodontics. Okay. Now, applicants to graduate programs in the Faculty of Dentistry must hold a DMD or its equivalent degree from recognized university, your DDS or BDS degree. The degree and diploma are awarded conjointly. So you have to finish MS also and you have to finish diploma also. So each program is designed in such a way that the research that you have to do is related to that particular specialty. Okay, if you are in MS craniofacial science in endodontics, the research is based on endodontics. Okay, so graduate will be eligible to take examination for specialty certificate of Royal College of Dentists of Canada and American Board of either Endodontics or American Board of Orthodontics, American Board of Periodontics, and prosthodontics. So that is huge added benefit for this program. You get a licensure to practice specialty in Canada plus the diplomat certificate from American Board also after completion of this program. So research is included, clinical practice is included, everything. Cherry on a cake, double cherry on a cake. Okay, so just on a second. Yeah. So international applicants must have a minimum overall average equivalent to UBC B plus 76 percentile in previous education. GRE is not required for this program, but if you have GRE score, you're encouraged to submit and preferences are given. Official transcripts and 3 references, IELTS academics with score of 7 with a minimum score of 6.5 in each component. Okay. So these are the only basic requirement for this program. The only thing I can see is the GPA, which is 3 or B plus. You should have sufficient enough marks to appear to be eligible for this particular program. But if you are, this is the best program for you to have. Obviously, of course, the program fees is much for international applicants compared to your domestic applicants. Okay, now apart from MS, they have PhD and diploma. Same program, but you have a PhD component instead of Master of Science. So again, this is advanced degree. Okay, just MS component is replaced by PhD component in craniofacial science, and it is combined with the different specialities. Okay, the requirement for this program stand the same, and you are again eligible to get a certificate from Royal College of Dentists of Canada, specialty, and American Board of Endodontics, Orthodontics, etc. So again, this is higher degree. So if you have done masters, I will advise you to get enrolled for this program. Only the thing is duration for this program. As it is PhD degree, the duration for this program is 6 years. Okay, the duration for MS program is 3 years. So you can pretty much correlate. If you are young, if you are very eager to get knowledge, hungry for knowledge, then yes, PhD degree, you can definitely enroll yourself. Okay, so now these are all the programs related to dentistry which Canada has to offer to you as an international dentist. Okay, so this will help you establish as a dentist either academically, clinically, or non-clinically, or research wise, but you'll be having your degree which is built upon your existing degree, your BDS or your MDS. Okay, so choice is yours if you want to get enrolled into research based program, non-clinical programs, or clinical based programs. Okay, now the second component of my presentation today is dental auxiliary program. Now why I have included this dental auxiliary program is The reason for this is, if you have to enter into Canada, if your final intention is to complete national dental examinations and not to pursue any particular program that I've mentioned before, because those programs are pretty much expensive. So what you can do is you can enroll yourself into these dental auxiliary program, get your Canadian education, get your Canadian work permit, start practicing, start doing these, start working in these profession, and side by side you can complete your NDEB examination once you have your permanent residency. So that is another, I would say, not a shortcut, but a different, little bit cheaper way to enter into Canada and to establish yourself into the Canada. Okay. Now these programs are dental hygienist, denturist, dental assistant, dental office administrator, and dental technologies. Now, the first one is very interesting, your dental hygienist. Unlike in India, dental hygienists are very actively involved. They have much elaborated work to do in Canada in dental clinics. So they have pretty much hold on dental clinic after a chief dentist. Okay. So dental hygienists, they work along with clients and along with dentists on patients and can treat them independently of the dentist with certain restrictions. Okay. These includes what kind of treatment you can do, scaling, root planing, educating clients, patient on oral hygiene, putting sealants on teeth, and teeth whitening. These are the things, or you can make impressions also. Okay. You can put varnish, you can put bases, these kind of work you can do. Further education can also be pursued in after completing your dental hygienist diploma or degree. And general dental practice, specialty office, independent dental hygiene clinic, research and education, and public health position are the work area where you can work after completion of this program. Yes, dental hygienist in Canada, they can open their independent clinic. Okay, they can do limited amount of treatment. They can ask other dentists to come and do the treatment, but they are allowed to open their own clinic. That is a huge thing. Now, dental hygiene programs, they're degree programs or diploma programs. Now, degree programs are offered by in Faculty of Dentistry, and diploma programs are offered by private or public colleges. Okay, so if you have the degree program is 4-year program, and diploma program ranges from 18 months to 3 years. Okay, so the duration is same, but the degree nevertheless, if you have degree program, you have completed degree program or diploma program, you'll be doing same duties. There is not much of a difference. Okay, but diploma program, degree programs are much elaborated programs. So once you have completed either of this, you can apply for a restorative dental hygienist program. Dental restorative hygienist program is very unique program, offered only by one college in Canada as far as I know. I'll tell you the name of that college as well. What happens is, once you have completed your diploma program in hygienist and you have 1 year of experience, you can apply for this program, which is duration of this is 1 year. And after completion of this program, you will be able to do extra work like doing advanced cavity preparations, advanced cavity restorations, and other treatment of dentistry. So this is again a huge plus point if you're really interested in dental hygienist program. So now admission requirements, as we are dentists, we are pretty much eligible for this program. Or if you are Canadian, the Canadian students, they have to have their secondary school diploma or grade 12 English, biology, or chemistry. Then in case of BDS students, you should have your official transcript. Some colleges, they do assessment examination, like to see your psychomotor skills. So they'll ask you to come to the college, or they'll take your interview to see the English proficiency. Okay. Sometimes the examination can happen online with telephonic interviews as well. Or the degree offered is bachelor's degree if you have done it from the university, and advanced diploma if from the private college. So which are the universities and college which offer this program? There are many, but I have included few. First two are the university which offer this particular program. So University of British Columbia and University of Alberta, they'll give you degree program. 4-year programs. Okay. Then George Brown, Algonquin, Toronto College, Fanshawe College, Durham College, these will give you an advanced diploma programs. So in these colleges, the duration of the program lasts from 18 months to 3 years. Okay. The George Brown is the college where you have dental restorative hygienist program. You have after completion of your normal hygienist program. Okay. So in George Brown College, dental hygienist program is for 3 years. And in Toronto College of Dental Hygienists, the same program is for 18 months. Okay. So college to college, there is difference in the duration of the program. So if you have to see and check with the particular college that which duration, what kind of duration is suitable for you. All right. Then next one is denturist. I hope you are surprised with this term, denturist. What is denturist? We never heard this kind of term in India. Okay, so denturist is again a special profession in Canada. In this, what you have is denturist, that trained individual who can design treatment plans and that improve a patient's oral health. So these are the professional who are responsible for designing and treating patient who need removable partial dentures, either complete dentures or removable partial dentures. Okay, so they will be treating the patient and they will be doing laboratory work for those patients. So it is program which train you as a clinician as well as a laboratory technician. Okay, so denturists are highly trained and licensed individual who design and creates removable denture prosthesis. Denturists are also responsible for creating mouth guards and bleaching trays. And duration for this program is 2.5 years to 3 years. And the program consists of challenging curriculums, including academic, clinical, and laboratory skills. Okay, so I've got many inquiries from dental technicians as well that they are interested in going to Canada. So I would say this is one of the program. If you have to attend, then you can get enrolled yourself into this kind of program, or even a BDS candidate can enroll, because this is again a clinical program where you can treat patient. And I have seen so many private denturist clinic in Canada. Okay, a big clinic with a denturist board on it. Okay, they'll be treating, because old age population, there is little bit old age population in Canada. Okay, so they need these kind of treatment. With advances of CAD/CAM technology and everything, it is becoming very easy and very rapidly expanding field, this denturist. Okay, so again, very interesting program, and duration is also 2.5 to 3 years. Colleges for this particular program, there are very few colleges which offer this program. 3 of them are in Ontario State: George Brown College, Georgian College, which is in Barrie, and Oxford College, which is in downtown Toronto, and CDI College, which is in British Columbia. So these are the colleges which offer this denturist program. Now, the next is dental assisting. Okay, now don't get confused yourself with dental assisting in India. We have a very poor kind of dental assisting which is happening in India. The dental assisting which happens in Canada is much advanced and very superior to what we have here. Okay, so again, this is highly regulated profession. You need to have licensure for Dental Assisting Regulatory Authority, DARA. Okay, then only you can practice as a certified dental assistant in a dental clinic. So students develop the skills, technical knowledge, and clinical experience necessary to work in a professional, ethical, and collaborative manner in variety of settings. Students in the program receive experience in intraoral skills. Okay, then digital intraoral imaging, laboratory procedures, infection prevention and control protocols, safety protocols, and business skills. So all things are taught in this particular dental assisting program. Dental assistant is integral part of a dental clinic setup, as always next to a dentist. Now there are 2 kinds of dental assisting: dental assistant level 1 and level 2. So now level 1, they have very limited amount of work. Okay, they cannot do much of intraoral work in patient's mouth. So level 1 students, they can learn chair side assisting duties. Duties include assisting to dentist or dental hygienist, taking and developing x-rays, mixing dental materials, oral hygiene instructions, infection control, instrumentation, sterilization, etc. But if you have done dental assisting program level 2, you are allowed to have more intraoral duties. They include making impressions, pit and fixture sealants, applying antichirurgenic agent, rubber dam placement, coronal polishing, and application of topical anesthesia. Okay, so these are the things you are involved in, and if you gain trust for a dentist, even you can do other things as well, like temporization, putting restorations and all those things. Yes, this is very much possible. Now I'll tell you how these programs and how this practice will help you for your future plans. Now the colleges, this graduate of this program are eligible to take National Dental Assisting Examination Board examination. Don't get confused with NDEB examination. This is not NDEB, this is NDEB examination for dental assisting. Okay. After completing this program, you have to appear for this particular examination in order to get the licensure. Now graduates from this program find employments in general and specialty private dental practice, public health unit, hospital dental clinics, dental industry, and insurance companies. And colleges which offer these programs are George Brown College, Ontario, Medics College, CDI College in Ontario and British Columbia, Toronto College of Dental Hygienist and Auxiliary in Ontario, and Algonquin College of Applied Arts and Technology in Ottawa. So these are only few colleges, all right? There are numerous other colleges which provide this particular program, but I cannot include all those colleges. Now, the next one is your dental office administration program. Now, this program is again unique. This is not regulated as such that you don't have to have a licensure to practice dental office administration, but yes, the experience is very important. Experience in case that there are particular softwares that they use in dental clinics. Like here we have Practo. Okay, in Canada the mostly is Dentrix or AbleDent. Okay, these two software, but they are very much elaborated softwares. Okay, so if you have knowledge of working of these two softwares, okay, you can pretty much do this dental office administration work. All right, so you're not directly or actively involved with the patient, so that's why the licensure is not required for this program. Now the dental office administration program will equip you with strong combination of office administrative skills and clinical knowledge necessary to work effectively in a dental practice. Just hold on a second, please. Okay, so now the course duration for this is 3 months to 1 year. Now again, if you can see the course duration, it is much lesser. Okay, and how what is taught in this program: to set up office system, organize and coordinate appointments, maintain and manage patient records, maintain accounting records, processing insurance claims. A lot of work in dental clinics happens with insurance, and utilize microcomputer systems. Colleges which offer these programs are George Brown, Niagara College, Durham College, Vancouver Community, and Northwest College. Obviously, there are other colleges as well which provide this program. Now, the last one is your dental technology. Again, interesting program. Why I'm saying this is interesting program? Because nowadays, if you see how rapidly the dental technology is advancing, how real-time things are happening in dentistry, the clinics, the labs, they are connected so much in live manner. Okay, so they need technologists who are adopted to new things, like your softwares, your CAD cams, and all those things. So again, this is one program which I would say, if you are a dental technologist, it will be very beneficial for you to attend this program, as there is huge demand of digital CAD CAM technicians in Canada. You should be able to prove yourself that you have that sufficient knowledge to get yourself involved in CAD CAM technology. You should have ExoCAD, you should have 3Shape, knowledge of all these programs. So each dental laboratory, they have huge setups. Okay, and the manufacturing, the fabrication cost of crowns is, you won't be able to imagine. A single crown, PFM crown with precious metal alloy, is cost 15 to 17,000 to a dentist, around $300 or $400. That is what dental laboratory charges to a dentist. And dentist charges much more. They charge around $1,000 to $1,050 to $500 for that crown. So This is again a huge scope, again very highly regulated profession. You should have to have license from regulating authority. In case of Ontario, there's College of Dental Technologists of Ontario who provides the licensure, and the duration for this program is 3 years. Okay, again I've told you huge demand for CAD/CAM technicians in Canada nowadays. Colleges which offer, there are very few colleges for offering this program. There is one college, Vancouver Community College in British Columbia, CDI College in British Columbia, Northern Alberta Institute of Technology in Alberta, College Edward Montpet in Quebec, and George Brown College in Ontario. George Brown is the biggest public college in state of Ontario. Okay, they almost have all the programs in that college. Okay, so now once you are done with this, it includes almost the core dentistry programs and the surrounding dentistry programs. Okay, so all those programs I have covered in this, which are possible for you as an international dentist to apply and to get enroll yourself into. Okay, now the next category is applied health sciences programs. Now, if you don't want to pursue your dentistry career but want to build something upon your previous knowledge or upon your previous degree, these are the program of choices. Many dentists, many healthcare profession, they are opting for these programs because it is again very subjective choice. If you don't want to get involved or don't want to practice dentistry, either research part, non-clinical part, or clinical part, you can enroll yourself in these kind of programs. Okay, these are very versatile programs according to different universities and faculties. So basically what you have is diploma or master's programs in healthcare management and administration, which are called as MHM or MHA, Masters in Healthcare Administration and Masters in Healthcare Management. So you have both diploma programs as well as master's program. Okay, then you have diploma programs in Health Informatics, which is new emerging branch in healthcare systems, and you have masters in business administration. So if you have some business ideas in Canada related to dentistry, or if you want to work in big dental clinic setups or big dental companies who deals with dentistry materials, equipments, and everything like Noble Biocares and all those things. So still you will be attached to dentistry, but you won't be practicing any directly dentistry related things. Okay, so again, it is subjective choice what exactly you want. So now healthcare administration program, interesting program. It is master's program and graduate certificate or diploma programs, as the master program is provided only by university, and graduate certificate and advanced diploma programs are the programs provided by private or public colleges. Okay, these programs, they run in collaboration between business and health science departments. So both the department, collaborative program, interactive program. Duration for these kind of program ranges from 1 year to 3 years, depending if you are enrolled yourself into full-time or part-time program. Now, as you can see, these programs are not practice-based programs. Okay, they are curriculum or course-based programs. So they are offered either part-time or full-time. Part-time is offered to those individuals who are actively involved in their profession or who are doing their jobs or everything. So for them, it is part-time program where you can go in during weekends, Saturdays and Sundays, and you can attend this program. Or if you are if you want to complete it in fast track, then you can enroll yourself for full-time program. Now, depending upon if it is full-time or part-time, it is either 1 year to 2 years to 3 years. Okay, delivery system, this program is delivered on campus, that actually you have to go to the college every day, or it is offered online. Both things are possible. Now, nowadays in COVID, all these programs are happening online only, but there are still some programs which regularly happens online. So you don't have to go to college. Okay. The focus of this program is on healthcare system, innovation, analytics, decision making, and cost effectiveness. So you just basically manage, you'll be able to manage the health setup, the dental clinic setup, the chain of dental clinics, or hospital setup, small hospital, big hospital. So these are the areas where you can find. So where you can find your work: medical schools, research groups, non-profit organization, and public policy offices. So these are the areas where you can work as a leadership program. Then master's programs which are offered by university is you need a professional degree. Now most of the healthcare administration and healthcare management programs, they need you to have a degree which is related to healthcare, like dentistry, then audiologist, chiropractitioners, or other healthcare related degrees. Okay, but as it is administrative or management related field, you should have to have GMAT exam. Not in all programs, again, not for all programs it is a requirement, but for most of the programs it is a requirement. Particularly if you're applying for administrative program, you should have to have GMAT score. And this is only for individuals who have some professional experience in their field. Okay, and again, proficiency of English has to be there. These are the requirements for your master's program. For diploma programs, only you should have to have a degree and proficiency in English. They don't look for GMAT or GRE or your GPA score. Then the university and colleges which offer these programs are, now I'm going to talk about a little bit about these schools, these universities who offer these particular program. The University of Ottawa, which is the Ottawa is the capital of Canada. It is on the border of Quebec and Ontario. So in that they have Telfer School of Management. So this school offers this program, Masters of Health Administration. Again, GRE or GMAT is required for this program, but very beautiful program. The duration of this program is 18 months. Okay. And you have to go to college every day to complete this program. All right. Then University of Toronto, they have Rotman School of Business. They offer Executive Healthcare MBA. Very, very expensive program. It costs you somewhere around 2 lakh Canadian dollars for this program, but you could finish this program in a year. And the best thing about this program is they'll expose you to curriculum in Singapore, London, and in USA and in Canada. So you will be going to all these 4 campuses, different colleges where they have their collaboration, and you'll be getting your different skills. This is University of Toronto, Rotman School of Business, Executive Healthcare Management Program. Okay. Then again, McMaster University. McMaster University, they don't have any dentistry program, but it is one of the top ranked university in the world. Okay. It comes around 78th best university in the world. It is in Hamilton in Ontario, and they have programs which is healthcare management, which is very, very good program. Not that expensive also. The fee structure for this is around $40,000 for international students. And the best part is that program is completely online. Yes. And you have to go there only for a week, twice in that particular year. Okay. You have to come to Canada and you have to attend college for 1 week. That is how it happens 2 times in that academic year. And the program duration is 1 year. Again, the requirement is for this program is you should have to have 70% in your BDS or MDS. And again, you have to provide personal letter of interest and references and all those things, which are very much ideal requirements for all the programs. Very good program from McMaster University, and it will give you a master's degree. Okay. That is huge plus point. Dalhousie University, again, it offers diploma program as well and master's program as well. Okay. Canada College, Constega College, St. Lawrence College, George Brown College, they'll offer you advanced diploma or graduate certificate, not master's degree. Okay. As I told you, the colleges, they offer you graduate diplomas or advanced graduate certificate, advanced diplomas. And all these universities, they'll give you master's degree. Okay. As well as diplomas. Now, there's one more field of study, which is emerging. Many universities, they have different names for this. Health Informatics or e-health. Okay. These are the program name for this program. Now, this Informatics in Canada is technology oriented course, which gives students knowledge in the field of healthcare, information technology and business. Okay, MS in Health Informatics is a course where technology and scientific knowledge interact with healthcare. So you'll be a bridge between researchers and clinicians. Okay, you'll be managing all the data. So you'll be like a hi-fi gizmo guy in healthcare profession. Okay, duration for this program, again, 1 to 2 years, depending if it is a part-time or a full-time program. Professional in this field of health informatics helps to solve tough problems such as how could you consult a doctor without leaving home? Could a computer diagnose disease? Could a computer model tell us whether closing schools would stop the spread of flu? How could technology empower people to become active managers of their own health and healthcare? How can we collect, store, move massive amount of health information safely and securely? So I told you, you'll be a gizmo guy in healthcare profession. So if you're interested in some IT related work, some artificial intelligence related work, and plus healthcare related work, so this is one program where you can definitely look forward to if you really interested in this kind of work. Okay. So now this covers basically everything. Okay, university for this and colleges for this. McMaster University, they have e-health program. York University, University of Victoria, Centennial College in Ontario, and George Brown College in Ontario. So these are the colleges. Apart from that, there are other colleges as well which provide this particular course. All right. Now, as I've told you all the possibilities and all the programs that as international dentist you can get yourself enrolled into. Okay, but before going for any particular program, there are certain important tips which I want to give you. These tips are not written anywhere. No one will tell you about this. Okay, not even universities, not even your friend, or not even other people. Okay, so listen to these tips very carefully. What you have to do is, if you have decided which program you are interested in, you have not done your ECA. If you have done your education credential assessment, then it is well and good. Okay, if you have not done, because it is a necessary component of your PR application. So it is basically what it does is, there are certain organizations. Most common is your World Education Service, which is called as a WES, WES. So you have to send your documents, your transcripts to this WES Canada. What it does is it calculates and it tells you your degree is equivalent to which degree in Canada. Okay, so the college people, it is easy for them to decide exactly what is the equivalency of your Indian degree or your foreign degree. Okay, so not all degrees are equivalent to Canadian degree, but best part about dentistry is that even if you have BDS degree or MDS degree, it is considered as a professional degree. Okay, it is as equivalent as master's degree. Even your BDS degree is as equivalent as master degree. That is not the case for BDS, your engineering student. Engineer degree is considered as a bachelor's degree. Okay, whereas BDS and MDS degree, they are considered as a professional degrees. Okay, that is huge benefit we have as a dentist. Okay, so get your education credential assessment done from ECA or ECA from WES Canada, not WES US, WES Canada. Okay, so just type on Google WES Canada, you'll go to that website. Just prepare your profile and submit all your documents. The transcript has to go from university directly to the WS, otherwise they won't accept it, and they'll give you assessment within a month or so. Okay, and it costs you around somewhere around 14,000 to 15,000 rupees. All right, then if you are applying for dental hygiene program, denturist program, dental assisting program, you should have to make sure that the college program in which the college which is providing this program, it is accredited by Commission on Dental Accreditation of Canada, CDAC. Okay, if it is not, then you'll land up in a trouble, because you won't be getting a genuine degree. You won't be able to practice those professions in Canada. So inquire about it, that their degree, the college degree, is accredited by CDAC. Okay. Now, next very important point, check for postgraduate work permit for programs and college you are applying. This is the website that I have provided, the link to the website. What this website will tell you, suppose you have selected particular program A in particular college. Okay. So as you don't have your permanent residency, as you don't have Canadian citizenship, what happens is if you finish your education there, they'll ask you to go back to your country. Okay. But the whatever program you have chose, you have to make sure there are programs in all these which I have mentioned, they provide you a postgraduate work permit. Okay, not all programs provide you this permit. What this work permit does is, if you have completed a program which is of 1 year duration, it will give you a postgraduate work permit of 1 year after completing your program. If you have done a postgraduate if you have done education for 2 years, it will give you postgraduate work permit for 3 years. Okay, so once you finish that degree, you'll be having a postgraduate work permit for 3 years. And if you have a Canadian degree, is 100% chances that you will get a work. Okay, and with the help of work permit, it is the same thing that what they do in US, your H-1B visa. Okay, so they get H-1B visa and subsequently they apply for the green card. So the same thing, you have done your Canadian education 2 years, then you will get postgraduate work permit for 3 years. So you have Canadian education, you have Canadian work experience. So you will enter in Canadian experience class, okay, in express entry pool. And this is very easy way to get your permanent residency. So once you finish your work, 1 year work permit or 1 year work, you can definitely apply for PR-ship. Okay. And again, lastly, contact colleges by mail and discuss the exemption from the course of the program if applicable. Now the program, they have divided into different courses. In one term, they have different courses, different components of the courses. Now, as we have done BDS, we have done masters, we are already aware of the situation. We already have the knowledge in dentistry, core knowledge. So if you're applying from dental hygiene program, you contact that college and you tell them that you have done this BDS program, you have the basic knowledge, so the course exemption can happen. So what happens is that 2 years program will become 1 year program or 1.5 year program for you. Okay, but again, you have to make sure the public colleges, they'll give you exemption, but if the college is private, they little bit hesitate to give you this course exemption, because if the course length is reduced, you won't be paying fees for the next year. Okay, that makes a huge difference. So particularly, generally they won't give you course exemption, but if you're lucky, you'll definitely get course exemption in private college. But in public college like George Brown College, you can definitely get course exemption. Okay, so the course will get a little bit shorter for you. So these are the important tips that you have to see to it that you cover all these things before going for any particular programs. All right. This CDAC, Commission on Dental Accreditation of Canada, it is not, you should not think about this if you're applying for dentistry related program in universities, because all those universities, they are already accredited by CDAC. Okay, only I'm talking about only college program like denturist, dental hygienist, dental assisting program, and dental technologist program. Now, the investment in education always pays the best interest, said by Benjamin Franklin. And of course, it is 100% true in case of Canada, because I'll surely tell you the bitter truth. Your BDS degree, your MDS degree doesn't stand a chance, doesn't hold any respect in Canada until and unless you have Canadian education built on that particular degree. With BDS degree, no one will entertain you. With MDS degree, no one will entertain you. They need to have a Canadian credentials in your file, in your CV. They need to have Canadian work experience in your CV. Then only it matters. Then only you can integrate yourself successfully and with confidence. And my friends, don't hesitate to get enrolled in dental hygienist, dental assisting, or these kind of programs. Okay, because trust me, every professional is respected and cared in Canada. They won't think you as inferior that you're doing dental assisting program. You have to establish yourself successfully in Canada. Go from root, go from base. Okay, and enrolling yourself into dental assisting, dental hygienist, what benefit it can give you? It can give you idea of clinical setup. So it will be very easy for you to pass assessment of clinical judgment, assessment of clinical skills, because you will be working with Canadian standards. Okay. And directly going from here and working and giving those exams, you'll find it a little bit difficult without training. With training also, you'll find it a little bit difficult. But when you're enrolled in these kind of programs, you will be pretty much confident when you're appearing for your ACS or ACJ examination, because you have done your education, you have first-hand knowledge of Canadian programs, Canadian education. Okay. So always try to, it is my personal advice, that invest in your education in Canada if you really want to get settled. And if you are young, if you're just finished your BDS or your MDS, invest yourself, invest your time, your money in Canadian education, because there is nothing like that. And lastly is, now I told you everything, what is possible, what is not possible for you. So it is up to you to decide what will be your move. Okay. You have to plan your move very meticulously. You have to think, you have to ponder very, very meticulously, and you have to make your move, whether you want to go in particular research direction, clinical programs, dental auxiliary programs. What is your final aim? What exactly you want? All these things, think about it. Make your move very carefully. Friends, I am making you aware for these things because no one told me these things. People are going from here with blind eyes. They don't know the reality there, and they'll face depression, they'll face problems there. So if you are here, if you don't have PR, don't think that you don't have PR. Invest yourself, your money in education. Get Canadian education, get Canadian credential, get Canadian work experience, and settle yourself and go for these NDEB examinations. That is all I have to say from my side. And I wish all of you very best of luck and Godspeed for your move and your decision, whatever you're doing, whatever you want to do in Canada. And surely, definitely, I'll see all of you there someday. Okay. So thank you so much for listening to me so patiently. And I hope it helped you a lot. And whatever I have from my side to give you, because what I have seen is when people go to Canada, they just go to Canada. They don't look back. They don't try to help. I'm helping you people. I want to share my knowledge. Whatever I have gained in 3 years, I'm sharing with you. Okay. And you can best utilize this and you can make your move. And you definitely can contact me anytime. Okay. I'll be glad to assist you in any case. Okay. Now, so if you have any questions, you can ask me the questions now, please. Yes, anything? Okay. I didn't choose any program. I was thinking about the program. See, my age is different. I'm 36. Okay. I'm thinking about the education program. But I'm in process of, I'm doing NDEP examination. Okay. Because my path is different. If I try to choose examining education, I have to spend a lot of time on it. Okay. I have different responsibilities on me, and plus side by side, I'm doing some other things as well in Canada. Okay. So if I have to choose, I will be choosing programs from University of British Columbia. I'll be choosing program for University of Manitoba. Okay. Which are master's program, because I'm interested in clinical programs. Okay. So these are the programs which I'm interested in. Anything else? Process of PR for a dentist any different than, no, it is not. Dentistry, dentists, they are treated equally, but the only difference is the provincial nomination. What happens is dentistry is very much regulated in Canada. It is completely regulated. So even if they have deficient dentist, okay, less dentists, they cannot ask dentists from other countries to come and work because you don't have license. So what happens is engineers, management people, it is not regulated profession. So they can directly ask these people to come from abroad. So some provinces, if they have requirement from engineers, they'll give you the provincial nomination. If you get provincial nomination, it adds 600 points to your CRS. Okay, so and you easily get into the PR process. But dentist, you hardly get provincial nomination. Okay, so it is not different for dentist. If with proper age and proper education and work experience, if you're entering in the pool, and if current trend for CRS is around 475, okay, last score was 478. So if your score is coming somewhere around that, you'll have better chances to get invitation for permanent residency. And provided that you have sufficient work experience of 3 years, and you have master's or bachelor's degree, and you have a good IELTS score. For PR process, you have to give IELTS general. So PR process for dentist is no different than any other profession. It is the same. Okay, I hope this gives answer to your question. What is eligibility for dental technology? I told you that dental technology, for that course, you have to have a 12 passing your 12th standard. Okay, so you have these college. If you send your mark sheet to these colleges, what it does is it evaluates your degree, and they'll tell you if you are eligible to apply for this dental technology program or not. Okay, so not much of the requirement, only 12th standard with biology, chemistry, that in India we call as you have done 12th in science based program. Okay, so that is the only requirement. And you should have good score in your IELTS, academics, not general. Okay, and if there are any other, some colleges, they ask for a psychomotor examination to see how your psychomotor skills are. Okay, some college they don't. These are only requirements. Okay, what should be CRS score minimum? Now CRS score, I told you the current trend is 475 to 480. So if your score is coming somewhere between that, you have short chances of getting invitation for your permanent residency. Next question, can we apply for PR before NDEB? And if so, then how can we survive based on our MDS degree or BDS degree? Good question. Yes, you can apply for PR. I tell you that you should apply for PR first, and then you should go for NDEB examination. Why? Because if you pass your NDEB examination, if you don't have PR, what happens is you won't find any job, because they give job to only permanent residents and citizens. So go for permanent residency first, and then go for NDEB examination. And if you have to survive with BDS and MDS degree, I told you, no one is gonna respect your BDS and MDS degree. Don't feel bad. Same thing happened with me too. Okay, you should have to have some Canadian credential. That's why these programs like Canadian dental assisting program, dental office administration program, because surviving without any job in Canada is difficult. You have to spend almost 2 lakh to 3 lakh rupees per month to survive. Okay, and it is not possible until and unless you are well enough financially. You have to earn in Canada, and how you can earn? By enrolling in these programs. Okay, then next question is PNP for dentistry. No, PNP for dentistry doesn't work, I told you, because provincial nomination program is such a program that if certain province, they find that we need engineers, mechanical engineers, so what they will say is we are inviting engineers, profiles of engineers from express entry pool. Okay, so if you have that degree, they'll give you provincial nomination. In dentistry, it is not possible, because we are in regulated profession, and until and unless you have license to practice dentistry in Canada, that province has no use of you as a dentist. Okay, one of my friend, he got PNP being a dentist. How? It was PNP of Ontario state, and his score was around 417, and the eligibility, and he has recently submitted his profile, and the only eligibility criteria for that particular PNP program was you should have CRS score more than 400, and you should have submitted your profile recently in last 15 days. He was luckiest of, I would say, all dentists, that he got PNP for Ontario state. Otherwise, don't hope for PNP for dentistry. It is very, very, very rare. Okay. Average salary for dental auxiliary in Canada? Good question. Average salary, I'll tell you, auxiliary dental hygienist, you'll find mixed crowd, males, females. Dental assistant, 99% females. Okay. Salary for dental hygienist goes from $20 to $70 per hour. Dental hygienists make good amount of money, not even for survival, even to have a good life. Okay, so dental hygienist, then followed by dental assisting. If you're level 2 assistant, then yes, you'll have basic wage of around $20 to $45. Okay, that comes for somewhere around $4,000, $5,000 per month, or maybe more if you're doing more kind of work. That you'll get pretty much good life in $7,000 or $8,000 per month. Okay, so I hope this is it. Whatever you have, if you have any other question, if you can think about any other questions, you can contact me by mail or my mobile number. My both Canadian and Indian number, they are working, so not much of problem. And I told you I'll be providing you a list, a PDF list with college name, programs, and the tuition fee for international dentists, so you can see which program suits you. Okay, so thank you so much, all of you, and I hope if you want to make some group or something like that, because helping each other is the key. If we help each other in advancing in going to Canada, we can make a strong community in there surviving, because references, cross references, all these things helps very, very, very well in Canada. So if you have strong community of people knowing each other right from India, it will go a long way, definitely. So if you people are interested in making some personal group where we can chat, we can discuss each other's idea, that will be very great idea. Okay. Okay, so I've got one more question. Can you tell me how many seats are there for ITDP in Canada, International Training Dentist Program? This is not mentioned anywhere. You have these programs. I know for Toronto, University of Toronto, they offer 26 seats. For University of Manitoba, I don't know exactly how many seats they offer. You can contact them directly and you can talk to them directly. Okay, but it is again very highly competitive program, so much applicants are coming in. Okay, and as an international dentist, you are only eligible to apply for University of Manitoba if you don't have PR or citizenship. So you can definitely contact them. They are very prompt with their response. They'll definitely help you out, because I couldn't find the number of seats, how many number of seats they offer. Okay, I told you for a master's program. For master's program, they offer 5 seats in perio, 6 seats in prosto. Okay, for DDS program, I don't have, I really don't know how many seats they offer. Okay, anything else? So I hope this works, and I'll be sending you the forms for giving review and some how you like my programs, my informations, and everything. So please give review for all my presentations and everything. That will go a long way for me to help and to cater more things in coming future. What else? And if you want any particular presentation from my side, you can definitely ask me, but do give review and fill the feedback form for my presentation. Okay, thank you so much, my friends, my colleagues, for coming here today and attending my presentation. I hope all of you very best of luck for your endeavor, future endeavor, and we'll see you soon. Thank you so much. Bye-bye.